Now for news about several recalls of fentanyl transdermal patches. Some of these patches may have defects that could allow the fentanyl gel to leak out. If the gel touches a patient's or a caregiver's skin, they could risk respiratory depression and possibly death.
One recall affects all U.S. lots of 25 microgram per hour Duragesic patches sold by Precara and its generic equivalent sold by Sandoz. All of these patches are manufactured by Alza Corporation and have expiration dates of December 2009 or earlier. Anyone who has the recalled Duragesic patches should call 800-547-6446 for instructions on how to return them. Those who have the recalled Sandoz patches should call 800-901-7236.
The second recall affects over a dozen lots of Activist fentanyl patches in all strengths. Note that the pouch containing the fentanyl patch may have an Abrica Pharmaceuticals label, whereas the outer carton has the Activist logo. You can find the lot numbers on our website. Anyone who has Activist patches from the recalled lots should call 1-877-422-7452 for information on how to return them.
If you have a defective patch, dispose of it immediately by flushing it down the toilet, but be sure not to handle it directly. Anyone who comes in contact with fentanyl gel should rinse the exposed skin thoroughly with water. Don't use soap because this could increase the drug's absorption through the skin.
As a reminder, fentanyl is a very strong opioid narcotic. The patches should only be used by opioid-tolerant patients with chronic pain that's not well controlled by other shorter-acting analgesics.
In addition, patients and caregivers should be educated about the signs and symptoms of fentanyl overdose, which include respiratory distress, shallow breathing, fatigue, sleepiness, confusion, dizziness, and fainting. And be sure that patients understand how to use the patches properly, including how often to apply the patch, reapplying a patch that's fallen off, replacing a patch, and disposing of a patch.
Finally, remember to tell patients that heat can increase absorption of the drug to dangerous levels, and so they should avoid heating pads, electric blankets, hot baths, sunbathing, and other heat sources while they're wearing the patch. And they should be cautioned to contact their doctor immediately if they develop a temperature above 102 degrees.